Aloha and welcome to Island Connections. I am Brahim Aude. Workers, tourism, and COVID 19. This is the topic for today's show. And to discuss this topic, we have Eric Gill, Financial Secretary Treasurer of Unite here, Local 5 in Hawaii. Thank you, Eric, for coming over and to discuss these matters with us. So, how is the situation? This beginning, how is the situation so far for you folks and any improvements, developments, progress, lack of progress?
Well, the situation is increasingly difficult for people as the unemployment subsidy has now been withdrawn, and the continuing lack of certainty about employment. And of course, we're approaching the time when many of our members will begin to lose their healthcare benefits in the middle of a pandemic. So obviously the situation on people is profound and disturbing and very difficult. The very little has been done, by the government for relief of the unemployed, furloughed tourism workforce sector. We had 3 sessions of the legislature this year, and of course it was cut short in the middle, but they came back twice and really put very, almost nothing into the relief of the furloughed hospitality worker population. And, our members are probably the best situated in that population, but many hospitality workers, don't have a union and don't have the benefits and the ability to sustain this. And so there really is a lot of suffering out there, and much of it is not shown. People aren't, they aren't publicly complaining yet, but there's a lot of suffering. We're starting a program. One of the programs that will be helping is the rent subsidy program that the state is pursuing with CARES Act money, and we're partnering with Catholic Charities to extend that. It's to help people pay rent. And the first text blast we sent out, we had hundreds of people applying already. As we are having to turn our attention to more social service, help our members, we're going to have to help them find new coverage. Many members have already lost their employer coverage, and we're trying to find them new coverage. And of course, what that means is, from the worker's point of view, they pay more for less coverage, and at a time when their income is down. And so, so it's starting to build up things are starting to build up and get very difficult. I think most of our members had hopes to get back to work in the summer. And then we've had, one delay after another. And so it's really hard on people, the sudden loss of, your hopes and dreams, and having to spend the kids' college money, and, uncertainties about the future. And it's a really terrible cost on working people who are unemployed through no fault of our own, and who the government has been largely indifferent to our suffering. The legislature came back into session. They took care of all the public workers, made sure that the budget was there for them to continue their employment. They never lost their employment or benefits, and shouldn't have. We were pleased. It doesn't do the economy any good to lay off all the people that provide services to us. But there was no similar attention to the private sector, and so here we are. Legislature ignored all of our requests to address the situation, and hasn't reconvened. And if they do reconvene, it'll be only to veto the governor's, override governor's vetoes if they can get the vote. So it's I think what we've seen here is a spectacular failure of leadership, political leadership, certainly at the national level, where we have a crazy, ignorant billionaire corporado who's turned loose all of the dark side people on labor rights. You know, there's been a terrible attack on labor's rights, you know, including a labor board decision just recently where, you know, they now can, you know, the courts are saying you can now get fired if you're a shop steward for speaking up and being impolite when management does nasty things to workers. And it, you know, that's just one of many, many examples. They've rolled back protections for workers. And this is being done with malice aforethought by the federal government. And, you know, everybody's distracted with all the antics of the clown that we have, you know, pretending to be president. You know, at the state level, you know, the governor has been, you know, he's finally making changes at the Department of Health. Those were overdue changes, in my opinion, and it remains to be seen, you know, what the new director will be able to do. But, you know, but the state government has been largely dysfunctional, unable to rise to the occasion. You could see that in the unemployment situation where, you know, this wasn't a fault of any of the workers there. They were working on a DOS computer system from the 70s, I think, or the 80s. You know, one of those with the computers with the dark screen and the blinking green cursor. You know, that's what the unemployment system was built around, and they couldn't even interface with, you know, modern computer networks. You know, so you know, it's been you know, that's decades of neglect. That's not Scott Murakami's fault, you know, although he took all the shit for it. That was, you know, what, 5 past governors didn't invest in the unemployment system. You know, so I think what's happening here is that the COVID crisis is masking in some ways, or it's creating a screen for an underlying economic crisis, which is deepening and deepening rapidly. I think the prospects for our industry are cloudy. Obviously, global tourism has been, you know, impacted heavily, and, you know, so all the attention being paid to let's opening airports and get our tourists back. You know, okay, we can open the airports. Where are those tourists coming from? You know, the Asian countries don't want people coming back from America, and that includes us. You know, so if the Japanese are going to quarantine returning tourists, then they're not coming here. And, you know, and American tourists aren't welcome anywhere in the world at this point. I mean, California people can't even go to New York. And yet, you know, we're inviting them all here in the hopes that we can get our jobs back. But there is a question, how many people will come here? What kind of people will come here? And what are they going to do when they're here? Are they going to respect our health issues or not? And, you know, we've seen, obviously, all of us have seen, you know, images of scofflaw tourists, you know, just breaking quarantine and doing what they want. And of course, you know, we have a more systemic community problem in that, you know, they failed to control the surge, at least here on Oahu. And so now neighbor islands don't want Oahu people coming. So, you know, in the course of all this, you got to wonder, you know, where is tourism going to stand? There's another complementary problem, Brahim, which is that, you know, the hotel industry is owned, the hotels are owned by entities that have engaged in, you know, 20 years of speculative real estate investments. And so those investments were all based on high occupancy and high revenues. You know, literally the way that they price hotel transactions, a sale of a hotel is not based on the bricks and mortar or the value of the land. It's based on the ability to pay the note. So in essence, they take the EBITDA, which is an acronym that basically means cash flow, the available cash, and they see what kind of a note it can support. And then they sold it, you know, they would sell it at that price. So all of these hotels, you know, have any of them that have been bought and sold in the last 20 years have been jacked up in terms of the leverage on those notes. And then you got to look at the players. These are people who are speculating in this market, commercial real estate lodging sector market, are big private equity companies, big REITs. These are, what they do is they load up debt and they strip assets off of companies to make their margins. And so all of these hotels are heavily leveraged, loaded up with debt, and many of them a lot of this debt is structured as bond issues. And what's happened now for the last 9 months is we've had, at the end of September, we'll be ending the third quarter of 2020. In the first quarter, January, February, March, the hotels were still full, still making money. They paid their note. No hotel that's structured on a bond structure has been able to pay note since March. So you have April, May, June, and then July, August, and September soon, where you'll have 2 consecutive quarters of non-performance for these bonds. And what that's going to mean is large financial institutions will have to shed that debt. They're going to have to move those bad notes off of their balance sheet to maintain their reserves for other investments. And so that means some of these hotels are going to fail or be sold, bought and sold. New operators new owners will come in, and those owners are going to take a look at the property and say, how do we make money on this property? And with tourism down, it's going to be a big temptation to take that hotel and turn it into a condo or some other purpose that will permanently eliminate the jobs that the hotels provide. So
but who's gonna buy the condo? Unless people from outside, yeah.
Well, that's just it. That is who's buying the condos.
Right, yeah. So let me, we will continue with this, but what I wanted to do is play a couple of segments from Rich Raff's videos that we recorded in the interview, just to give like comparison between what used to be in the hotel industry and the restaurant industry before and what's happening right now with the pandemic, etc. So we play the first video with Richard Raff. Okay.
Ethnic Studies has this community orientation, which I'm thriving in that atmosphere. And so the work I do with Local 5 is informed by my own personal history. The reason I'm so interested in this particular union is that before I went back to school, to undergraduate as an adult scholar. And before that, for 15 years, including my undergraduate time period, I worked in the hotel and restaurant industry. I had worked in restaurants since I was 15 and worked my way up from a dishwasher to a sous chef, and was a line cook and a prep cook, and pretty much every job in the kitchen, I did it at one point or another. I was in a non-union restaurant, actually a lot of restaurants. I worked in 35 or 40 different restaurants over those 15 years. But they were all non-union. And that's part of why I worked in so many, because if I needed a sick day or if I wanted to take some personal time, the way we did it in the non-union shops was that you quit your job, and as long as you knew what you were doing, you could get another job.
The other one I want to play for Richard Raff's interview is about a minute and a half and so on. And he talks about like how the pandemic, started okay in Hawaii, not too many hits, not too many infections, and later on just went berserk, for our numbers, and that. So we'll do that, and then we will talk more about what you have been dealing with and connecting it to Richard Raff's. Okay.
During the pandemic, there's a crisis, but there's another side to it as well with the pandemic, because hotels and restaurants outside of large factories, if you remember back in March and April, the super spreader COVID places were meat packing plants, chicken factories, that kind of thing. And businesses then ignored the warning signals, didn't deal with the COVID, and tried to operate business as usual until people started dying. And then even then, they tried to deny the problem until they really couldn't because of the deaths. The restaurant and hotel industry, once the hotels have opened back up, there's a few examples. One is Myrtle Beach opened for Memorial Day. They had a COVID per 100,000 rate, COVID cases per 100,000 per day, similar to how Hawaii's was in May, like very low. And 2 weeks after that, it jumped exponentially, like 10 times as high. Same thing in Las Vegas. Las Vegas didn't close the hotels quite as thoroughly and reopen them gradually. But as they reopened, the safeguards to have safe reopening that management and industry leaders and the government put in place were insufficient. Workers said this, complained about it, and were ignored. And the hotels basically became super spreaders, and Las Vegas, the numbers quadruple.
You know, in Hawaii, in terms like how many hotels are open, or you know, are there any hotels that are open, and if that's the
There
case,
are.
how they are treating the workers, etc., etc.
Well, there are a few hotels that are open. Most of them are not represented by us. We do have a few hotels that have taken guests and that are currently operating. And you know, what Richard said here is really an important issue. You know, the reopenings that have happened did not happen with consultation with workers. You know, the workers' concerns were in essence ignored, and the workers' safety wasn't adequately attended to. And you know, and those became super spreader events. And so we do have some hotels that are open. There's a couple that we represent that are taking guests, several, and with one exception, you know, we found that they are not ready to do it right. And I think that the basic problem here is that the people who create the safety protocols don't actually work in those areas, and therefore they come up with these general safety protocols that look nice on paper, but you have to actually apply them in practice at the point where people work. So, you know, it's nice to say social distancing shall be practiced in the hotel, which is what they all say, of course. But how do you do that in the freight elevator? You know, how do you do that in a housekeeping briefing, you know, when, you know, 50 people are crowded in this little room? You know, how do you do that? You know, you have to change your way of operating, and that's what they're not good at, and that they're not doing that generally. And so what's happening now is, you know, hotels are operating with inadequate safety standards for the back of the house. Back of the house meaning where people work. Front of the house is basically where guests go. And even in the front of the house, we see that there's some real lapses in compliance with policies. So one of the big ones for workers, obviously, is that, you know, masking is the most important tool to spread, you know, just to impede the spread of the virus, is to get everybody masked up. And the purpose of the mask is to protect the other guy. Most of the masks that we wear aren't N95 masks. They don't filter out everything. So if somebody doesn't wear a mask, they're the ones who are spreading to others. And so, of course, it's obviously important to us that guests who deal with us should wear masks, because we're the ones who would get it spread to. And hotels don't enforce that well. They don't, you know, and so we've had to inspect and look and see for ourselves. And so in the Union hotels, where we've had the right to go in and look by virtue of our contract, what we found is that the hotels that aren't operating have done almost nothing to use the time, the closure time, to get ready to operate safely. And the hotels that are operating are hit and miss on safety standards. And so they're, you know, the model that we're trying for is to actually create a situation where it's not just protocols on paper, but those safety precautions are actually dealt with at the department level with the managers and workers who actually work there to take that safety precaution and apply it in practice. What does that mean in the bus station? You know, what does it mean in the locker room? You know, social distancing in the locker room. You know, if there's a lot of people in the locker room, I shouldn't go in. And yet, am I going to get written up for being late on station because I'm waiting at the locker room? These are the kind of details that need to be addressed, and that only workers and, you know, managers as well, the people who work in the hotel, need to be able to have that discussion and to do it right. And the discussion is not just to come up with the right policies. The discussion has to involve workers so that they understand the reasons for these policies. You know, we have members say, I don't want to wear the mask. Okay, well, you have to pose the question back. Do you want to get all your friends sick? And that's the kind of social reinforcement that is needed. If workers are involved in developing the training, then workers will also be involved in making sure that people, you know, do what is necessary. So what we see is that in general, we, you know, the places that are open, there's a bunch of them that are non-union, and we haven't been able to get to go back and look at the kitchens and the employee cafeteria, the locker rooms, and all those places to see the back of the house. I am very skeptical that they're handling it right back there, but we have been able to go and look and see in the public areas, and the truth is, many of them aren't following their rules even out there where everybody can see. So we've put together a website, a public website, to, you know, publish our findings. You know, we're doing hotel inspections for union and non-union, but, you know, to get into the back of the house in the non-union where the workers actually are and where the dangers are, we haven't got there yet in some of those non-union hotels. But you can go down there and go in the lobby. You can go on the pool deck, and we've taken pictures and are posting them. We want people to be able to see, you know, here's a hotel with a social distancing policy saying, you know, guests supposed to stay apart, and yet you take a picture of the pool deck and they're all clumped together without masks and all that, and no one's enforcing the policy. You know, and this can be pretty nasty as well. I mean, we had, you know, our union represents workers all across the country, and, you know, we had the casinos that Richard mentioned. You know, the guest masking policy in, you know, in the Vegas casinos lasted 8 minutes, not even 8 minutes after the opening, because the TV cameras were there taking pictures. Here's all the guests in the casino, and nobody had a mask on, and they're all clumped up and all breathing, you know, and of course our members are masked up the way they should be to protect everybody else. And yet guests are here breathing in their face, you know, and now that we know that that's the main way to transmit the disease, you know, the guest masking policies are critical to worker safety. And if workers aren't safe, the guests aren't either, because if somebody gets us sick and we pass it around in the back of the house, it's coming back, you know, we're all in one building. It's like a cruise ship on land. And so how do you know, without firm policies that management is going to enforce and that workers have been involved in creating, we don't believe there is a real safe environment there. It's just, and it's an outbreak waiting to happen. And, you know,
yeah, may I
yeah, please.
interrupt? I wanted to play another segment from Rich, because he's talking about the role of the hotel lobbyist and all of this we're talking about. And then I would ask you about, you know, if you talk to the hotels and what do they say? And the other thing is, what's the role of the state in enforcing these matters, you know, especially in non-union hotels? But we'll watch Rich's segment and we go from there.
The hotel and lodging industry lobbyists lobby very hard, especially in Hawaii, to reopen without bringing workers to the table. Now, I don't know if you've ever had a manager at any of your jobs in your life, but managers cannot do the jobs that workers do. When they come in and try to, like if a worker walks out, it's an utter disaster, like right out of like Laurel and Hardy or something. And the workers are the ones that actually know how to clean the place, how to keep social distance and still have the job get done. They know what's needed. They know what changes need to be made as far as hours, as far as structural changes, like physical changes in the restaurants or hotels. And they involve a number of things that the industry does not want to deal with. So they involve basically, the industry is looking at unemployment as a boon where they can have fewer workers do more work because it's an employer's market because of unemployment.
Yeah, so he mentions stuff you already talked about in terms about the managers cannot do much, and all these kind of things that look nice about what you should do and shouldn't do, like protocols and stuff don't work because workers were not at the table.
Yeah, I mean, the truth is we want to build on a shared interest in developing that back and out safety. I mean, the truth is, Rich is right. Most managers can't just jump in and do the work, but they can't. But they do have a shared interest because if we get sick, they get sick, and we're all working in the same place. And so, what we've been trying to do is get that discussion past all the lawyers and the bean counters and all the lobbyists and all those guys that all say all these things, but they don't know anything, and get it down to the department level where people actually have a shared interest to build to be safe. I mean, manager or union, nobody wants to take some deadly virus home to their aged parents or their young kids or anyone, and so we're trying to put the emphasis where it will do some good. And the imperatives, the incentives for workers and for line managers, people in the departments, is to be safe. It's not true for the owners, as Richard pointed out. The billionaire bosses of our country have definitely and overtly, you can read it in the Wall Street Journal, they believe that a substantial number of unemployed people will make them more efficient, which means paying less people to do more for less, right? And so that's how they think. They're capitalists. They can't help it. That's what they do. And and then you get down the layers, the owners, and it should be noted, there's any hotel it's not a hotel, like you can speak of it as one entity really, because the ownership and the operators are different, and they have often conflicting interests. And so in this particular situation, the owners of the hotels, I mentioned them earlier, they've scraped all the reserves out, and big scandal that you guys have all read about putting it all into stock options and management bonuses and that sort of thing. So they scrape all the juice out, and then when it's time to cough up some money in a pandemic to keep workers employed or keep workers covered under insurance, they haven't released a dime. So the owners are being tight, waiting for this financial fallout, and the management firms then have no money to spend on worker safety. And so what we have is a kind of a capitalist structure that is dysfunctional in a basic way, to actually deal with a situation where they have to put something out for the community that they've been taking money in from all these years, and they're just not up to it. So the other aspect, of course, is that, as I mentioned, a lot of these hotels are going to be in free fall economically, so they're holding on to their cash because they want to buy hotels that falter, where the economics makes them vulnerable. And so it's again the same speculative real estate bubble that has built us up to be so high level risk right now is the same bubble that's creating the conditions that they won't invest in people's health. So Richard's right about that, and then it reflects out in the lobbying, so the hotel association, these are management groups, and they hire Mufi to go talk to them and, talk to people for them. And Mufi's telling all the politicians, don't worry, we got it. We know how to do safety. And of course, that's not true. And so we've been having to kind of show evidence that they are not prepared. And that's another reason we put up our website. We really believe that, we had to do this because the government has been unable to step up to the plate to compel. And that's here in Hawaii. Now, it's not true everywhere. In San Francisco, the Board of Supervisors passed a very stringent ordinance, and that has induced the hotels there to really start talking about safety, because now they have a government mandate. The casinos in Nevada that Richard referenced, they did it wrong. They reopened. They got pounded. Only after people died. I think we've lost about 20 of our members in Las Vegas already, but only after people die, then the Nevada legislature passed a pretty comprehensive safety bill. So in other words, the government entities, especially here in Hawaii, have, they wait until the problem whacks people in the face, and by that time people are dying, and then they take action. And we haven't been able to get state to do it here. We've approached the legislature, we've approached the governor, we've approached the city, and so far, we just haven't had a government entity willing to step up to the plate and say, here's what we require for safe operation of the hotels, which is kind of crazy, because for years and years we've had laws on the books for the safe operation of restaurants, inspectors and everything. They close restaurants if they violate Board of Health requirements, and yet a hotel where you have a lot more people crowded in and a lot more, they're not stepping up to the plate. So we're very disappointed in that, but that's why we've had to develop our own tools. If the government won't regulate, we want consumers to be able to have an informed choice and be able to dial into our website, and if they're planning to check into Hotel A, they can go and see the inspection reports for Hotel A, whether Hotel A has published its safety precautions so everybody can see it and enforce it, and whether they're following their own rules that they have posted. All those things are relevant to me as a traveler the next time I travel and check in. And I think that's important in the next phase in our collective lives here. Traveling public is going to be far more safety conscious, going forward than they have been so far.
Yeah. It appears that the lobbyists here, Hotel Tourism Association and others, private and the quasi-public associations, etc., have a lot of clout, and that's why the state is not responding clearly and in terms of protection of workers and visitors as well. So
just to put a point on that,
go ahead.
The government is upset with the industry for leaning on you got to open, and yet one of the key tools in opening is the quarantine, and yet hotels don't want to take quarantine people. So that's I mean Hawaii people need a place to go. If I'm living in a home with 12 people and 3 families, as many of our people do live that way, because of the high housing costs and people wanting to own, and people struggle to get into a home, and yet if one person gets sick, the whole place gets sick. Where do they go? And yet hotels won't take them. So on the one hand, hotels are leaning on the government, open so we can do business, but the business that's here now, that Hawaii people want to go have a place to go, they don't want that business, and so it's a terrible thing.
Yeah, because they want bigger fish. You know what I mean? Yeah, that's the thing. So there's a lot of pushback against the government to open up. But Ige, for instance, he is not protecting, the people the way they should be, especially in the tourism industry. But at the same time, he's not strong enough to counter the lobbyists and the pushback from the big corporations, etc. Here, what I want to do is play another segment from Rich, because he talks about why that is going on, and also how he went on inspections, like you were saying, and what happens. We'll do that, and then we talk more about it.
The hotel workers invited me to go on an inspection of a property. So the hotel management has taken the governor on inspections of some of these properties, where they show them the outside and the lobby in a room, and that's about it. And they put up some signs and some plexiglass. But the union actually has access to the innards of the hotel. So when we did our most recent inspection, what we found is that the hotels are woefully unprepared to reopen safely, woefully bad. The ones that are ready are actually, there's one hotel, the Kahala, that is working with labor, and they're coming under a lot of fire for doing it. So that's the narrow part of it, is that workers, it's crucial to get workers involved here, because it's not going to open safely otherwise. And that holds for workers at the University of Hawaii, including professors who need to be at the table when discussing how to address the proposed budget cuts. So basically the whole top-down model isn't working because practically by design. It's a function of capitalism itself.
Is Kahala still open, or what?
Yeah, the Kahala has Kahala is distinguished, is different, and partly because of the ownership question. Kahala is owned by a Japanese company that runs. It's not a timeshare operation; it's more like a club operation, and so they had a great interest in getting the place open, and they told the manager to open, and they decided to work with us, and we've been working with them. So the owners permitted and supported that process, which is the big difference, I think, between Kahala and other properties. But in general, as Richard said, they've had, and it's been very frustrating, because we've demanded in writing that they bargain their safety with us, and the hotel corporations have collectively come to the conclusion that they won't do that, that they don't have to, and therefore they won't. And when we ask for detailed safety precautions, they haven't sent them. They send us these 9 pages of PowerPoint, where half of it is, titles and stuff. And you can't dig into that and find anything that's actually enforceable. So they've wasted the last 5 months, in my view, working with us and with the workers to really sort these things out, so that they could reopen in a confident way, and workers would be confident they're safe to go to work. So, because there's that too. I mean, despite all the hardship, many of our members are not enthusiastic about going back to work, because they don't see that anything's changed. And many of them, are senior workers. Those are the first ones to be called back, and they're the ones most at risk for COVID, right? The people my age and, my generation of workers is now approaching retirement age, and nobody wants to die before they can retire. And so it's really difficult sometimes for workers. But that's why it's important to look at the protocols. I got to look at Outrigger's one, and Outrigger, everybody should know, this is not a Hawaii company at all anymore. The Kellys are gone; they got kicked out. KSL owns it; it's a big private equity company. And but Outrigger's protocol is, if you turn down work, in other words, if a senior worker says, I don't want to come to work, I don't feel safe, they're going to take away your unemployment, which is just cruel, and cruel to the senior people who are most at risk. And so these are the kind of things that, that you got to look for if you're going to see the real impact on people. Also, it's like, Mufi has his protocol, and it says, well, if you're sick, you should stay home, right? Of course. Is somebody going to pay you or not? And that's a big question, because if nobody will pay, and if a worker has to take a suspension, in essence, every time they're sick to keep everybody safe, workers can't afford to do that, especially after what, almost 6 months of unemployment. And so we got to do better. And it's true to say that the lobbyists are clogging it up. They certainly are. But it's also true that other communities have seen through this and seen past it. One thing I would point out, the notion, that part of the lobbyist thing is, you have to give us a date to reopen, Governor, because we got to get this hotel industry back in shape. We need to reopen. And that's kind of a lie. I mean, it's a lie, basically, because just because the airport quarantine is dropped doesn't mean these hotels are going to reopen. What happens is they want a date so that they can take reservations. And if the reservations don't add up to enough occupancy, they're not going to open. They cancel those reservations. And they've already done that. July, August, each time it's been dependent, this is what they've been doing. So it's still a big lie. It's like, we're going to reopen. We got to do it right now. They're not committed to reopen, no matter if the airport opens or not. And so that's, there's just a lot of untruth about this, and all the attention paid on testing incoming passengers. Of course, that should be done. But the hotels are refusing. Tell me to my face, don't even ask for testing for workers, because they don't want to take the cost of that. And yet, how do you have a safe, bubble if the front door has a lock on it and the back door is wide open? And in fact, most of the outbreaks we've had in Hawaii have been community transmission, from the back door. If you look at, some of the early ones, the McDonald's ones, you look at the Maui Memorial outbreak. If you look at pretty much any of these outbreaks, the clusters in Kalihi Valley, of course, these didn't come from guests. These came from our communities. So, so the big failure, I think the state's starting to turn around. The big failure was they refused to do mass testing. And only in the last few weeks did that happen, right? Because the federal money. And now what they're finding is what they should have found out early on, that the outbreak is still fairly localized, which provides an opportunity to actually, contact trace and quarantine and try to suppress the outbreak without having to lock us all down. But because they failed to do that, we got locked down now twice. And so the government got to get a hold of the community thing too, in order for tourism to work.
Yeah. So another thing, like, what Mufi was saying, like, if you are sick, you stay home. That is like really cruel, because he doesn't understand what people are going through, and that they don't have money if they don't go to work. So it's amazing, these guys. But not only him, like, he's reflecting or expressing the corporation's positions, as you have soundly and clearly mentioned. There is, we are recording this ahead of time, the show, but there is something called Finding Hawaii's New Economic Equilibrium. This is the Hawaii Economic Association, and they have a 2-day webinar, October 7th and 8th, 2020, of course. And the topic is interesting. How Hawaii can recover and prosper sustainably in a global economy faced with COVID-19. The interesting thing about it is that, one of the interesting thing about it is that there is this guy, David Carey, former CEO of Outrigger Hospitality Group. He's there, and you were just talking about, Outrigger, for instance. And I look at all of these are business people. There is one person from State of Hawaii Chief Economist, Eugene Tian, I don't know if you know him. Also, all of them are business people, and a couple of guys from, government, like Chief Economist of State of Hawaii. and there's only one professor from the economics department, but there's nobody from the tourism industry representing the workers, like for instance yourself. So how can you do that, trying to figure out how to open safely and all of this and be competitive, blah blah blah, etc., when we have all these kinds of problems that you are mentioning, and the hotel ownership is participating in that cruelty and in opening unsafely or closing at all. So your comment.
Well, exactly right. Look, the business, I mean, let's put it this way. The notion that we're all in this together is just, it's a nice phrase, but it isn't true economically. The hotels have an interest, and let's put it this way. Some hotels, in fact, Highgate is a big private equity firm that owns, I believe, 6 hotels. And early on, like in April, they permanently laid off everybody. And other hotels have done that sequentially. You send a warning notice to the company, but the actual permanent layoff is when they tell workers, you're not coming back. That's a real problem, because what they're doing is they're shedding the workforce so they can bring people back cheaper and fewer. And so that is in fact what is the industry is talking about. The Wall Street Journal, some of the business press, they talk about how do you afford the new safety precautions that is needed, and their solution is to eliminate jobs, to free up that cash flow. And so we have to wonder here in Hawaii, when our economy is built on tourism jobs, what the impact's going to be. And in particular, it comes down in particular forms, like the removal of daily cleaning of rooms. And they say, we have to do this by, eliminate daily cleaning of rooms. They've been trying to do it for 10 years. And we've been fighting them on it for 10 years and successfully so far. And now they're using this as a pretext to eliminate daily cleaning of rooms, which they claim is for safety reasons. And yet in China, they do it because the government tells them to do it for safety reasons. Or Hyatt says, it's unsafe, we won't do it except for our high-end guests. Okay, so it's unsafe except for the rich people? It's just, they're hypocritical on this, and the real attempt is to eliminate jobs so that they can have, whenever we come out of this, a much leaner, cheaper workforce, which is capitalism in action on their side. But on our side, we're the people of Hawaii, we're losing our jobs, and Hawaii's losing our tax base. And so keeping us out is convenient for them, because then nobody's speaking up about, hey, what about the jobs that you're shedding? And how is the state going to have a school system, a university system, or a health department, or any social services if nobody has, if we lose thousands and thousands of jobs? Eliminating daily housekeeping jobs eliminates at least half of the housekeeping workforce. And that's in most hotels, it's in every hotel, it's the biggest group. And in some hotels, it's the majority of the workers. And so we're talking about a business plan for Hawaii that includes far fewer jobs. So we've been very concerned about recall rights, and we've asked the government to put those in. In other words, let's stop the hotels from just shedding workers and their obligation to workers, because we have a collective interest as a community to have those jobs and to make sure that our community isn't stripped of the income we need to exist. And to be clear, we're talking about, nice to see David back in action. He got fired by KSL. They kicked him out. And there's nobody locally here that can influence them. They do what they want. We know how to influence them, but it involves a lot of campaigning. But again, what we have here is we have a divergence of class interests in the economic impacts of this. The COVID thing, okay, everybody can get sick. The economic thing, now we're seeing the class struggle playing it out under cover of this COVID pretext to slash and burn our workforce and to decimate our tax base. So we think, yes, the government should absolutely say that you have to take workers back. You know, when business come back, you have to take your workers back. You can't just get somebody else for cheap. And secondly, we should be telling the hotels, you have to bring back the services as well. And housekeeping, daily housekeeping services is one of the most important ones in terms of generation of jobs. But think about it, they're all eliminating valets, parking valets. They're eliminating front desk. They want everybody to check in, you know, on the app now. They're eliminating bellman jobs. You know, they're saying it's unsafe to touch bags. Literally the other day we had a guest, they didn't have a bellman, they laid off the bellman and they had guests, and she couldn't even get a bellman wagon because they were chained up. She actually put all her stuff on a sheet, one of these nice sheets, and she dragged it through the lobby on a sheet. It was a nice piece of guest little demonstration there. But that's what we're facing. You know, they want to reopen, but they want to reopen without many of us going back to work, and that's a tailspin for our Hawaii's economy if our main industry is permitted to just shed jobs in a major way. You know, and so, you know, they certainly have their books to balance and all those things. And obviously we can't work in a place that is bankrupt. So, you know, there's always a balance to be had. But the government needs to adjust that balance. They need to put a floor on the things that can be done to our people here. And I keep telling the government, you know, those people are not Hawaii people. The owners are not Hawaii people. And all the management firms are not Hawaii people either. You know, the managers work for them, but the people making the decisions are not from here. This is not their community. And the people that are in the industry that are here are the workers. We are the taxpayers. We are the citizens. We're the ones that the government's supposed to be taking care of. But how can the government then take a position, well, we don't going to get involved between management and labor? It's like we don't want to defend our Hawaii's people against global exploiters. And it's even, you know, one of the hotels even said, we're permanently laying you off and we're bringing in subcontractors. And this is another way of just shedding responsibility for safety, you know, because the subcontractor can't deal with, you know, there's no way for the subcontractor to talk about locker rooms or cafeterias or elevators. They don't have the authority to do that. And then the hotel sheds its obligation to the safety of those workers, which is criminal. But yes, we need the government to make them bring people back to work. We need the government to make them bring the services back to work so that we don't lose whole categories of workers. We need the government to ensure that the hotels are transparent, that they publish their safety protocols so everybody can see them. We need the government to make sure that people can go look, us and other people, to make sure they're following what they said they're going to do. We need incentives for safety. We suggested that the COVID claims be compensable, you know, automatically presumed to be compensable under workers' comp. If that's the case, then the hotels are going to be far more attentive to safety because they actually have some skin in the game and have to pay. So all those things we're putting in to try, we're suggesting, and those are the things they don't want suggested in that forum, which is why they didn't invite me.
Yeah, that's good. So we have a few more minutes. I want to play one last segment from Rich because he talks about capitalism and the profit motive, etc. You know, which you talked about, and then we will kind of conclude in some fashion.
The profit model is always geared for the short term and always geared for obviously profit. That's so. In order to seek profit in the short term, it's designed to cut costs at every corner. And even when things are going well, the way capitalism has turned in the late modern or postmodern era is that even when things are going well, you create a false crisis in order to make cuts. And prior to COVID, university was actually in one of these artificial fiscal cuts from the previous disaster of the financial crisis of 2008. The university never came out of the fiscal crisis there. So then that artificial one is compounded by the actual crisis. And now we're basically trying to fix a problem that's somewhat of our own making and somewhat not. So this is, Naomi Klein calls this the shock doctrine and disaster capitalism. And the idea is that corporations are using the pandemic in order to increase their coffers. The stock market is booming. The wealthiest 1% have added billions of dollars to their income during the pandemic. Meanwhile, working people are supposed to take the hit. So the risk in capitalism is displaced upon workers who remain precarious and barely getting by. And the benefits of capitalism drift upward.
Eric, in the beginning of the show, you mentioned like how the pandemic has been masking the crisis of capitalism, you know, that we had before, but also it has exacerbated it as it is masking it, and you know, and that is an important thing to note, it seems to me. And also another thing, I want to connect it with an article that was also on the Sunday paper, September 6th, by Sean Higgins. He's like from the Competitive Enterprise Institute, and he talks about gig workers and how the unions are gonna be like, losing a lot of membership, etc., and so forth, because of the independent contractors of the gig workers. But I'm thinking about like hotels. How could hotel workers be gig workers? They clean from home or whatever. So he hasn't talked about all of that, but it is true that the unions are facing a huge problem, as you have been talking about. So what is the counter thing for you folks, you know, counter plan, etc., to try and ask, for instance, the state government and the federal government, I'm talking about all of the unions, to really step up to the plate and protect the people of Hawaii, of the United States, against this pandemic, and to help them through this crisis, which is of their own making, the corporate crisis of their own making. So we have, I think, a few more minutes we can like talk about that. Yeah.
Well, I mentioned some of the things we had suggested to the legislature. We were rebuffed. They told us, oh, we can't put anything new this year, even though they did on many other things. So the legislature they heard us a second time and then spit us out. We're still hoping for the governor to be able to, we've suggested some of the measures I talked to you before, you know, bringing workers back, make sure you bring the services back, you know, make sure that they post their safety protocols. Those are all things that we've developed because, you know, because of the situation that we're at with all the competing adverse incentives. So the government has to put incentives in and disincentives and regulation in order to stop, you know, capitalism from just doing what it does, which is flow to the highest profit. And we have to be able to regulate and guide the capital flow in such a way that it benefits us here, not just the global corporations that operate here. So yes, we want to do that. We've suggested to it, and I'm screaming as loud as I can about it.
Okay, great. We're flat out of time. Thank you very much, Eric, for coming and discussing this matter with us. It's a huge topic. And mahalo nui loa, and see you in November. Aloha.
Okay, thanks, Brahim.